Dr. Christine Horner is a nationally recognized surgeon with 2 board certifications, the National Board of Surgery and the National Board of Plastic Surgery, and has even consulted with past presidents of the United States. Her 5-year crusade, the Breast Reconstruction Advocacy Project, led to the passage of laws in 35 states and a federal law. Dr. Horner has been featured in major national magazines, including Ms. Magazine, Glamour, Elle, Allure, and Women's Health Weekly, plus the New York Daily News, USA Today, and recognized by Oprah as part of her Angel Network.
80% of all Americans suffer from back pain at some time in their life. To treat it, people use medications, physical therapy, and even surgery. In staggering numbers, Americans are now turning to effective natural approaches, including the ancient Chinese technique of acupuncture. 44-year-old Bank Vice President Steve Wilhelm has suffered with severe, debilitating low back pain for years. Permaculture recognizes that you can skillfully manipulate the various elements in an ecosystem. For example, you can protect plants from insect pests through a procedure called companion planting. Jackie began researching natural options, and she discovered that millions of Americans had found relief from these dark areas of depression through 2 herbs, the Ayurvedic herb holy basil and the golden yellow flower St. John's wort. Oregano was revered by the ancient Greeks and considered a cure-all in medieval times. And it isn't all folklore, because recent research has shown the oil of this plant is a strong antibacterial and antifungal. The injury happened during a lightning and thunderstorm. Jackie came out to try to coax her 1,100-pound horse Charlie into the barn. There was a flash of lightning, and Charlie bolted, running right over Jackie and slamming her into the ground. Yoga means union. In medical terms, it's called psychophysiological neuromuscular integration. In layman's terms, it means a profound state of balance between the mind, body, and spirit. At the back of the eye is the retina. It's where visual images are converted into nerve impulses and carried to the back of the brain.
Dr. Horner, it is an absolute pleasure meeting you. Thank you so much for taking time to discuss the Nutria system with me.
Oh, it's my pleasure.
So, Dr. Horner, let's get right to it. What causes our skin to wrinkle and make us look older than we feel?
Well, our skin tone and elasticity is due to our connective tissue, and specifically elastin and collagen fibrils. So what happens with aging is our elastin and collagen fibrils start to break down. We lose water content to the skin, and then the skin starts to thin, and that's what causes wrinkles.
Well, I know you've had a chance to experience the Nutria skincare system for yourself. And in your opinion, are the ingredients used in the Nutria's formula effective?
Well, what I believe is that since aging of the skin is both an external process and an internal process, this system addresses both very effectively. And there's actually been quite a few studies that have been done, and what it shows is that there's an active ingredient called an amino peptide. And you can think of it like a little piece of protein, but it's a very special piece of protein, and it has very specific actions. So what it does is it stimulates a certain type of cell on our skin called fibroblasts. And fibroblasts lay down collagen and elastin fibrils, and they are helpful for the connective tissue in our skin. And what's fascinating is they found that these little amino peptides are something that actually work on the level of our DNA. So it stimulates genes, and these genes give messages to the fibroblasts to produce more collagen, create more skin cells, which thickens our skin cells, brings in more blood flow to it. And so what we found clinically, meaning following patients and studies over the course of a couple of months, is that their skin has more tone, more elasticity, and the wrinkles are less.
So this works.
It does. A product that works.
Exactly.
For Natural Health Check, I'm Dr. Christine Horner.
About your health, there's just so much information out there right now about the fight against breast cancer. A lot of ways that it can help ward it off. There are some things that can also increase the risk of getting the disease. Some things that maybe doctors don't even know about it, but not Dr. Manny. He is the all-knowing Fox News medical correspondent. You have a special guest.
Yeah, we have a special guest. Christine Horner is not only a plastic surgeon, she's a world authority on breast cancer, and she has a new book, Waking the Warrior Goddess, which is natural ways to prevent and treat breast cancer. And we have her, she's here this morning. Dr. Horner, good morning.
Morning.
How are you?
I'm
now,
doing great.
What are the things that are associated with increased risk of breast cancer? Foods in particular.
What we found is the American diet lifestyle is really a recipe for breast cancer. And some of the things that we do that significantly increase it are eating red meat. So they found that women who eat the most red meat have a 400% increased risk of breast cancer. Also, drinking alcohol. So they found that women who drink 1 drink a day have an 11% increased risk. 2 drinks a day increases it by 22 to 40%, and 3 drinks by 33 to 70%.
So does that mean no alcohol, period?
That means when it comes to breast cancer, no alcohol is safe. It's something that increases estrogen and decreases our liver enzymes' ability to detoxify the body.
Now, there's a lot of studies talking about natural herbs and supplements. What are some of the things that are preventative in breast cancer?
Well, certainly eating a plant-based diet seems to have a tremendous effect. And there's certain vegetables, cruciferous vegetables, for example, like broccoli, cauliflower, and kale, that have chemicals in them that fight breast cancer very effectively. One of them is called indole-3-carbinol, or DIM in supplement form, and it'll shut off a key enzyme necessary for breast cancer to grow, plus cause our body to create more of a good protective kind of estrogen and less of a bad cancer-promoting type.
Now, is it better to get these supplements? Because, you know, we get a lot of viewers that, you know, sometimes they want to take a pill. Is it better to take some of these supplements in a sort of a pill artificial form or foods?
You can, actually, because it is tough to drink. For instance, green tea has tremendous effects, and you have to drink 6 to 10 cups a day. And there's maitake mushrooms and grapeseed extract and so forth. So this is why I actually worked with enzymatic therapy to create a supplement called Protective Breast Formula, and it's got 7 different supplements in one. And we know that some of these show that, what the research shows, that even if you don't change anything in your diet and lifestyle, which I don't recommend, and you take one supplement, you could cut your risk in half.
Now, if we were to tell women out there that are watching this program to just change one thing that will make a difference, especially in breast cancer, what would you tell them?
That's tough because there's so many things that contribute to it, but I certainly think eating more plants and taking some supplements.
Very good. Thank you so much, Dr. Horner.
You're welcome. My pleasure.
Great book and great. I love chapter 28. A lot of good tips. Well, Bridget, there you have it. It's a very good book. I think it has a lot of good information, and diet seems to make all the difference in preventing breast cancer.
With everything, right? All right, Doctor, thank you so much. Oh, email
and
address.
If you have any questions or comments, and we're probably going to be talking about this in the book club with this great book, you can email me here at Fox at drmanny@foxnews.com.
All right, Doctor, thanks. See you again tomorrow morning.
And helping to spread awareness about breast cancer is a former Cincinnati native who practiced medicine at UC and Good Sam. Fox 19's Megan Mangello has more on her ideas about treating the disease naturally.
Dr. Christine Horner says her mother dying of breast cancer was the motivator. She left her practice as a plastic surgeon and began concentrating on finding answers to the disease.
And I instantly found thousands of studies that show exactly why we have a breast cancer epidemic, all the things that we're doing to contribute to it, and the things we traditionally don't do in this culture that are highly protective.
Sitting at the Mantra Wellness Center in Blue Ash, Dr. Christine showed us what she did with that information. She wrote the book, Waking the Warrior Goddess. It explores healthful ways to fight and prevent breast cancer. Some of her suggestions are simple, like a good night's sleep, going to bed by 10 and getting up by 6.
If you go to bed by 10 o'clock, your melatonin levels will rise to their highest possible level, and there's actually a spike between 12 p.m. and 1 a.m. that you don't want to miss, because if you do, the consequences are absolutely spectacular.
It's not just behavior. Dr. Christine says we also have to be careful of the foods we eat or don't eat in our diets. She recommends taking supplements to get nutrients we wouldn't otherwise digest.
Flax seeds have been found to be the most potent foods you can possibly consume to protect yourself from breast cancer or help you fight it if you have that disease.
And more tips like that are contained in Dr. Christine's book that just won an award from the independent publishers. Megan Mangello, Fox 19 News.
Dr. Christine is also credited with helping to pass legislation that requires insurance companies pay for breast reconstruction after a mastectomy.
our DNA repair itself. So our DNA is our blueprint, that gives all the information for the structure and functions of our body. And there's mistakes that can occur in the DNA or damage that can occur to the DNA all the time. And if it gets in the right level, then the information that's transcribed is something that can promote the growth of cancer. Folate is very important in our body's own repair mechanisms to make sure that the DNA is repaired properly. So women who drink alcohol and have low folate levels have one of the highest incidences of breast cancer. Now here's a little teeny tiny ray of hope. There was a study that was done where they had women drinking alcohol and they gave them folic acid or folate, 400 micrograms a day as a supplement. And most of the negative effects of alcohol went away. Now the bottom line is alcohol is really not the preferred health drink. But if you want to have a glass of wine every now and again, take 400 micrograms of folate. I should have stock in the company, right? Oh, I think you can't take it anymore. All right, so there's more bad news, but I'll leave it in later. So here's the good news. And the good news is, once again, there's lots of good news. There's so many things that you can do to cut your risk, and virtually everything, it's a 50%, 50%, 50%. So researchers have found the most health-promoting food that we can possibly consume are plants. Well, why plants? Well, plants have in them all sorts of vitamins and nutrients and minerals that are very health promoting, but they also have this very interesting classification of something called plant chemicals or phytochemicals. There's hundreds of these chemicals in every plant. They have no caloric value, they have no nutritional value, but what they are like natural medicines. And the research on them is absolutely phenomenal in how they work. This is something I was really surprised about because, I thought that the research was sponsored by pharmaceutical companies and I wouldn't find anything on natural approaches. But in fact, I found thousands and thousands of studies and very sophisticated research done here in the United States at institutions that you might have heard of, like Harvard and Yale and MD Anderson, that are looking into these natural products and plants and so forth. So what I'm going to do, we're going to really lighten things up here now. So now we're going to play a guessing game. So what I'm going to do is tell you about a plant and have you see if anybody's smart enough to figure out what the chemical is or the plant is. And if you are, Adrienne, wherever she is, she's now Vanna White, has door prizes for those of you who are very smart. So here we go. So first of all, the first thing is a plant chemical. And you can also guess what the plant is too. And this particular plant chemical is something that will shut off a key enzyme necessary for breast cancer to grow. It will also do something to the estrogen receptor. So here's my little props here. So here is a breast cell. Normally it's not blue. And it has receptors on it. So there's estrogen receptors. An estrogen molecule comes over, grabs onto the receptor, and again, it turns it on like a lock and key. Except it's not like an all or none phenomenon or on-off. It's much more like a volume control or a rheostat. There's many different things that will affect what that volume control is. So saturated animal fats and trans fats turn the volume up, which means the cells will grow and divide much faster in response to what they normally do. This particular plant chemical turns the volume down. So when estrogen hooks onto it, the cells will not grow and divide as fast as what they normally would. Next thing it does, in the liver, this is the liver, which looks amazingly like a breast cell. In the liver, toxins are broken down, estrogen is broken down. So when estrogen comes off of its estrogen receptor and comes to the liver, it's broken down into these byproducts. And for lay purposes, I call them good kind of estrogens and bad kind of estrogens. So the good kind of estrogens, just like their name implies, are something that are very weak and they do not promote the growth of breast cancer. In fact, they think they are a little bit protective. The bad kinds speed up the growth of breast cancer quite a bit. Now the ratio that you have of the good bad kind of estrogens in your body is very important because what they found is that women who have breast cancer on average have 4 times the amount of bad estrogen in their body compared to to the good estrogen compared to women who don't have breast cancer. You can check your own estrogen ratios by ordering a test from the internet called Estronex, and it's real fun because you get a kit and you get to pee in a bottle. And then you send it to a lab and they check and they can see what your ratios are. If you consume this chemical as a supplement or the plant, they will see that your ratios start to change within 24 to 48 hours. Very powerful. Now, one other thing, so the next thing it does, which I think is just really cool, and it's a real interesting concept that most of us don't have, and that is, our DNA, which is the blueprint for our body's physiology and anatomy and everything. We used to think that that molecule was stable and that it didn't change at all. Well, the researchers, since we've been doing all this molecular and genetic research, have found that that's not true. In fact, there are molecules that come and chemicals that come and hook onto the DNA all the time and are turning certain genes on and turning certain genes off. So in each cell that we have the entire blueprint for our bodies, but only certain genes are turned on at a time. It's easy to understand, like in the liver, only the liver genes are turned on, and the kidney, only the kidney genes are turned on. And there's some intelligence, amazing intelligence in our body, which I call the warrior goddess, that is managing all of these different functions in our body. So the foods that we eat, the supplements we take, even the thoughts that we think produce chemicals in our body that hook onto the DNA. And they will turn certain genes on and turn certain genes off. So this chemical will turn on a tumor suppression gene. That gene produces proteins that suppresses the growth of tumors. Okay, any guesses?
Broccoli.
Broccoli. We have a big winner over here. So broccoli. Now broccoli is a part of a family of vegetables called cruciferous vegetables. All cruciferous vegetables have certain chemicals in them. The one I was describing is called indole-3-carbinol. So they all have indole-3-carbinol. They also have something called sulforaphane and another thing called calcium D-glucarate. And they all have very powerful anti-cancer effects. They are so powerful, they help to prevent prostate cancer, colon cancer, even heart disease. So the National Institute of Health, a conservative organization, has recommended that people include cruciferous vegetables in their diet all the time. In fact, one serving a day at least, because they're so highly protective for our health. Now, if you don't like broccoli, like George Bush didn't like broccoli, you have 12 other choices. So there's cauliflower, cabbage, kale, and collards, and watercress, and on and on and on. So if you don't like broccoli, like I said, you have all these other choices. You can have bok choy, is another one too. Some of them don't seem related at all, but you can get the list and see that. So that's a very important vegetable to include in your diet. Organic and fresh. Next, plant. This is something that is consumed a lot in Asia. In fact, most everything I'm going to tell you about is consumed a lot in Asia. Gee, why do they have one of the lowest incidences in the world? So this particular plant is something that will decrease the amount of estrogen that our body produces. The next thing it does, I need like some good-looking single man out there. There must be someone. Here we go. Here we go. Okay, we have multiple. All right. Okay, so this particular plant, he has to stand here now, right here. Okay. So this particular plant, what they found is that estrogen is not only produced by the ovaries, it's also produced by fat cells, which is why obesity, more than half of us are like overweight, 60%, it's getting worse. Obesity is associated with an increased risk of breast cancer because fat cells produce estrogen. After menopause, the fat cells become a factory for estrogen. So the more fat cells you have, the more estrogen you have. In fact, they think of all postmenopausal breast cancers, 20 to 30% of them have obesity as one of the major risk factors. So what happens when an estrogen is released from the ovaries or from the fat cells
It's either released in the blood all by itself, looking for a receptor. You can go for the receptor in the breast cell, or it can attach itself onto something called a sex-binding globulin. If it's attached to a sex-binding globulin, it does not want to go to the